What's up guys, how you doing? It's Blake here with GuerrillaZen Fitness, and in today's video I have something really special for you and kind of new. I basically just finished recording an interview with my friend Sam Visnic, who's a super knowledgeable massage therapist, and basically we talk about a lot of stuff in here that you're not going to want to miss. We talk about pain science, the latest in pain science. We talk a lot about posture and how that relates to pain, the neurological issues associated with pain, how your eyes, your ears, and your neck affect pain, and some other stuff with regards to pain science, posture, corrective exercise, so on and so forth. You're not going to want to miss this. Sam is a super knowledgeable person. I always look up to him and go to him for insight because he's older than me and he has more experience than me, and yeah, that's basically who he is. I want you to know that neither one of us are medical professionals. We're not doctors. We're not giving you medical advice. And basically everything that we discuss in this interview is just for informational purposes only. I hope you enjoy it. What's up, Sam? How you doing, man?
How's it going, Blake? Good to see you, man.
Yes, good to see you as always. Glad that you're here with me today. I'm excited to talk to you about this stuff and learn some stuff myself, and hopefully you can drop some insight on anybody that's watching or listening to this too.
Yeah, I hope so too. Let's drop some knowledge bombs.
Yes. So, a lot of times interviewers will introduce the guests that they have. I'm a bad interviewer, man. I want you to introduce yourself, kind of tell people who you are, a little bit about your background, what you do professionally, so they can kind of get an idea for, who you are.
Well, where to start? I mean, put simply, I'm a clinical massage therapist, and clinical, and I say that as different. It's not like I work in a relaxation massage center. My work for the last 16 years has been looking at posture, looking at alignment, and working with people with chronic pain and doing specific hands-on soft tissue therapies to help them overcome that sort of thing. And also I'm involved, just like you, we've done a lot of corrective exercise work, a lot of numerous certifications in that area. And I just really advanced my work into that area. So for me, the average person that I see on a daily basis has got some kind of chronic pain pattern that has been unresolved, and they end up in my office, and we do assessments and help them resolve those issues.
Yes, awesome. Yeah, and for those of you listening, that's why I, am interviewing Sam today. I kind of look at you, Sam, as like an older, much more experienced version of myself, somebody that has just been in the game longer and collected more knowledge and wisdom. And every time I talk to Sam, he always presents new concepts and ideas that are, pretty much, either totally revolutionary in my mind or at the forefront of, innovation, the stuff that's the latest and greatest, coming down the pipe. Sam always keeps, he's always learning more. He's always at the, like I said, the forefront of, advancement with his education and research and what's out there. And I always learn something when I talk to Sam, which is why I wanted to have him on here today, because I know he's going to drop some knowledge bombs on me. I'm going to learn a lot from this, and hopefully you guys will as well watching this. That being said, there are a couple topics that Sam and I agreed to talk about here on this interview, just so that we can keep things concise and moving forward, because I want this to be close to 30 minutes, maybe a little bit less. So I'm going to kind of basically open up a topic for Sam to talk about, and then I'm basically just going to let him kind of discuss this topic, because all of these things that we're going to talk about here today are not well known, and they all pertain to like posture, corrective exercise, pain science, and everything related to that. So yeah, we'll get started right now. The first thing that I want to ask you, and this comes from Paul Chek, right? The eyes auditory system thing. Right,
well, he talks about it. There's a lot of people who do talk about it as well.
Yeah. Okay. Well, I'm not too versed on it, but I want you to kind of explain to me and anybody that's listening how the eyes, the auditory system, and the upper neck influence our body systems, our posture, and all of that, because that's something that's just not talked about a lot. So would love to hear your knowledge on that.
That's a really great topic to discuss, and a lot of this has come out of, and I think that what you had mentioned is that over the years I've discovered a lot more, and I'm always coming up with new theories and so forth, and a lot of it is just basically is based out of dissatisfaction with getting results to stick in the body. You and I are both very much aware of the influence of anterior pelvic tilt on posture because the pelvis houses the center of gravity. So when the pelvis tilts forward, the body will go forward, and now the body has to overcorrect by extending itself. So we know that when we stretch the hip flexors, we know that when we activate the glutes, when we get the abdominal wall fired up, that we start to be able to make impacts on the body. The challenge that we have with that, though, is that we have higher neurological centers in the body which are going to fight with us a little bit about keeping those results. So, the pelvis itself, if you think about it,
you mean physically higher up the body in the kinetic chain, right? Like the head.
Yeah, importance. If you think of it just from a primitive standpoint, what's important to us is to be able to keep your eyes and your ears level with the horizon, to be able to get your teeth to line up so you can eat, and so you can be safe in your environment. Your body will sacrifice things that it doesn't see as important, like the alignment of your pelvis, to be able to keep those higher neurological centers functioning as they're supposed to for survival. So you can imagine that if somebody's got something going on up in their body and, they've got a lot of anterior pelvic tilt and they've got low back pain, for example, when they stretch and they strengthen everything around the pelvis, you could have these higher systems basically fighting against keeping that pelvis in alignment. So people will always have to be stretching. They'll always have to be doing activation work and so forth. And when you identify some of those problems that are higher up in the chain that may be conflicting, you can get those results to stick. And sometimes, oftentimes, I'd say, in cases where people have a lot of issues in the upper quarter with those areas, you can resolve pelvic problems and everything lower in the chain without even dealing with it.
Interesting. So, can you give us like an example of a specific maybe issue down further in the kinetic chain, like the pelvis, that can be caused by a specific problem with the eyes or the neck or the ears? Can you give us an example of that?
Yeah, and this comes from looking at work like, for example, the jaw and the pelvis have a reflexive relationship with each other. So when somebody has, something going on with their teeth, let's say that they had an accident where they damaged a jaw, or, they have an infection, a root canal or something like that, and just consider all of the possibilities that this floating joint can do in terms of how the jaw moves. Wherever the jaw is going to move, it's going to influence the position of the head and the neck. And however the head and the neck moves, we're going to have a countermeasure going on in the pelvis in order to balance our body out. So that's a very simple example right there. And the body is going to do what it needs to do in order to protect, the position of the jaw. Another example would be, and it's not really common knowledge, this is one that most people haven't heard of, is the power of their prescriptive lenses. And there are things like, for example, when you talk to behavioral type optometrists who have the thought process that continuing to give people very powerful corrective lenses constantly and sharpening and tightening their vision creates tension in their neuromuscular system. And as you create tension in their system, it's going to influence the tension in their musculoskeletal components, right, their extensor chain and so forth, and can influence how much, drive we have in the nervous system to pull people into extension. And as we extend them, guess what we're going to get? We're going to get a lot more anterior pelvic tilt. We're going to get a lot more hip flexor activity. We're going to get inhibition of the abs and all that kind of stuff. So these are just two examples. I know they're not exactly simple examples, but this is the kind of stuff that our bodies, we have going on, and that they influence our basic efforts to overcome chronic muscle tension,
Yeah, that's very interesting, because I think when people oftentimes can intuitively tell if their hip flexors are tight or overactive or something like that, or if their abdominal wall is like shut down, because they can just feel it, But I think a lot of times they place the focus on those areas themselves and not the root cause behind the dysfunction in those areas, right? I always tell my online coaching clients that it's very rarely the area that's dysfunctional that is the cause of the dysfunction itself. It's usually coming from, above or below that joint. Those are the culprits that are causing that joint in the middle to become, symptomatic, if you will. So, basically what you're saying is problems with the eyes, problems with your hearing too. And when you say upper neck too, are you talking about like the top of the cervical spine, like C1 and C2?
Yeah, because the way that we have, if you think about this from a maybe another way of putting this also is that you're as a human being, you're standing upright, you're resisting gravity, and you're moving around in a three-dimensional space. A lot of these components, whether it's the inner ear, the alignment of the jaw, the eyes, are getting information from the outside and processing that information to tell us where we are in space. We have to have references, and those references are how our teeth fit together. The references is how we see with horizontal gaze, our inner ear balance. That information is constantly telling us how to right ourselves when we're upright and we're moving around. And some of those systems oftentimes have conflicting information depending upon what's going on in the body. So the question really comes down to is why are your hip flexors tight? Are they tight for a reason? They probably are because, just like anything else, your body is not stupid. It's not doing things for no reason. And it doesn't negate stretching the hip flexors. You stretch them, you reposition your body. What I'm talking about is what happens when those basic core elements of corrective actions aren't sticking or they're not working. There is something else that may be driving that tension that is not being addressed.
Yeah, absolutely. Yeah, I always say that like corrective exercise is good, but it's really treating symptoms. If you look at the muscular imbalance or the tension or the postural distortion, that's just a symptom of another root cause, right? So if you approach this functionally, that's just not enough. You can't just do corrective exercises and hope that your body is going to fix itself because you're not getting down to the foundational underlying mechanism behind the formation of those things in the first place. So this might be a hard question to ask, but I am going to ask it anyway. Dysfunctions in the eyes and the auditory system, the upper neck area. Is there any advice that you can give people that can like help improve those areas just here on this interview? Or is it just kind of like pertain to like which area they're having dysfunction in, like the eyes and the neck? Do you have any advice for people that might be struggling with issues in those areas that they can, take action on now?
I think the biggest problem that people have is identification of a problem in those areas. I think with the upper neck is pretty easy because most people don't realize that headache activity, visual strain, jaw tension, a lot of these things could be symptoms of having imbalances, let's say, in the upper neck. On more than one occasion, I've run across people.
When you say that, too, you're talking about the atlas and the axis?
Yeah, the atlas and the axis, C1, C2.
Yeah. So for those of you guys that don't know what that is, those are your topmost vertebrae in your cervical spine. They're like right underneath your skull, and your brainstem actually comes down like through those vertebrae. So they're very influential over the whole entire nervous system. Correct?
Yes, and trying not to get too complicated here because this discussion can really go into the deeper components of sympathetic nervous system drive and the key areas that are influential there. But when you think about the upper cervical spine, about 50% of the rotation in your neck comes from just C1 and C2. And the muscles that you have in there, the suboccipitals, the muscles at the very top underneath the skull, those areas, as the neck extends, can become chronically fatigued. They develop trigger points. Those trigger points refer pain around the ears over the top of the eyes. So where I was going with this is a lot of people have chronic headache problems that are always resulting from chronic stress, strain, and neck tension. And oftentimes they are seeking out medications to overcome these problems. Nobody seems to know what's wrong with them, and all it takes is a few quick soft tissue mobilizations, and I can get a headache to shut off if that's the issue. And it's always shocking to them because they don't understand the power of the musculoskeletal system instability in that upper neck and what it does to all of those structures, like the jaw and the eyes and so forth. So I forget where I was going with this, but these are important structures, and they all work together. You can't have some problem with the suboccipitals and the alignment of the upper neck and not have some kind of changes in the tension in your facial muscles as they relate to your jaw. Yeah. They're definitely related.
Interesting. Yeah, my original question there was like, what can people do about this?
Well, what you do is, and I was saying there, was proper identification, and that's where the primary issue comes. If there's anything like headaches going on, you've got symptoms in the upper body, then there's usually something that's related in there. So what you first need to do is identify it. Do you have jaw tension? Do you get headaches? Any of these sorts of things, and start trying things to disengage that area. For a lot of people with chronic tension in their jaw, the exercises to at least throw a wrench in the wheel of this is pretty simple. Yawn, stretch your jaw. If you're getting a lot of visual strain, what you should be doing is making sure that you're not sitting, you have appropriate ergonomics so that your eyes aren't straining. Make sure that you have good corrective lenses. You've got the right prescription.
What do you think about these, like blue blocking lenses for computer work?
There you go. And people are sitting in front of a computer, for sometimes 12 hours a day, and they have eye strain, and they don't realize it. But taking some kind of action to throw a wrench in the wheel like that can make them feel differently. And if they feel differently, they may have a problem in that area, which means, hey, maybe I should go see a specialist about this and have it checked out. So that's the challenge, is that a lot of symptoms aren't obviously related to those areas. But the symptoms that people are experiencing, at least there are components that are involved in what we're talking about that can really help them if they're resolved.
Interesting. Do you think that some posterior neck massage with a tool right at the base of the occiput, the skull, would be beneficial?
Yeah, there are simple tools out there, like, for example, those still point inducers and so forth that people can rest their head on.
What about a peanut?
Yeah, the peanut would work. Sometimes it depends on how it's placed underneath the head, because oftentimes if it's placed in the wrong spot, people's head will extend over it, and they don't really get the result that they want out of it. But nodding motions actually help out a lot when people learn how to just nod their chin and tuck back and retract.
I teach that a lot. Okay, so that's very interesting, man. So for you guys watching, 3 things that you might want to do to help stop dysfunction in the eyes, the auditory system, and the neck and the jaw that Sam's recommending is anything to reduce eye strain. Blue blocking glasses like this can help. I had no idea that something like this, could help with, postural issues and muscle dysfunction. I wear these primarily for, to prevent cataracts and stop my circadian rhythm from getting all messed up. But that's very interesting. So wearing things like that can help. Stretching your jaw, and then getting a peanut. You can buy these online from Amazon, or you can make one by taping 2 lacrosse balls or tennis balls together, putting that at the back of the skull, laying down on it, kind of pushing the tongue up in the roof of the mouth, putting the chin down towards the chest, and just kind of gently rolling on the back of those muscles can all help. Yes.
Yeah, in non-specific therapies sometimes can help a lot because it helps you identify that there might be a problem there. You don't have to know the perfect mobilization, the perfect way to address that area. The first trick is throw a wrench in the wheel. Take some eye strain off, do some neck massage, stretch your jaw out. You start getting improvements, and all of a sudden some of your corrective activities are now starting to produce better results. Then it might be something to look at, and that's my take-home point there.
Yes, very interesting. So in a roundabout way, doing this kind of stuff can actually help with anterior pelvic tilt, overextension of the lumbar spine, some of these other issues that are related to dysfunctions in this area.
Yeah, and I think that's another key point there, is that people will oftentimes look for miracles, meaning what we're not saying is you just put on a pair of those glasses and all of a sudden your posture is going to be better, your pelvic tilt's going to completely resolve. What we're saying is that these are contributing factors, just like when we talk about with health. If you consume a lot of foods that have a lot of processed garbage in them, if you have you're coming across allergens constantly. Now, these things aren't necessarily things that are going to put you in the hospital or cause your symptoms to go, really south and create and destroy your health, let's say. But they're contributing factors, and the more of those contributing factors you take away, you give the body more resources to be able to build health.
Yes.
I mean, that's the real trick here. So, everything in the body is reflexive. Everything works together. And if there's lots of stresses that are scattered all over the place, even if they're small stressors, they will contribute to the whole problem. And that's what we're looking at.
Absolutely. Yeah, I like that idea of physiologic load, right?
Yeah.
It's human beings like to be able to find one factor and blame that one factor on all of their health issues,
Yeah.
But it's rarely the case. Usually it's a multifactorial issue. It's the fact that you are not sleeping properly. It's the fact that you're sitting in a chair not moving for 8 hours a day. It's the fact that you have dysfunction in these areas. It's all of these things compounding on each other that are, causing you to, suffer, basically. It's not usually just one thing, right?
Absolutely. And people have a hard time understanding that sometimes when I do health evaluations with them, and I'm like, if you're sleeping 4 hours a night and you're expecting to overcome a chronic pain issue, you're making our work extremely difficult, and you're putting too many eggs in the basket and say there's just going to be some exercises and stretches that fix this problem.
Yeah.
Well, yeah, it's a component of it, but if your nervous system can't relax and you're not recovering, you're spinning your wheels. I have a hard time with, and I struggle with people with upper problems like jaw tension, eye strain, and chronic cervical problems who drink too much caffeine, and they don't understand the relationship. Well, if you drink a lot of caffeine and you stimulate your sympathetic nervous system, you increase chronic tone, muscle tone, or tension in the twitch muscle fibers, and you make things more difficult to relax. So you can't always work miracles with movement. Sometimes you need a little help on the health side.
When I used to work with in-person clients, I had this one client who was a very successful businesswoman, and she came in one day and she's like, "Wow, I'm really stressed about this meeting, so I drank a pot of coffee this morning." And I'm like, "Oh, you drank a pot of coffee because you're stressed? Like, do you think that's helping you cope with this situation?" Yeah, that's funny. But we're getting off track here, man. This is we could probably talk about that.
That's what happens when we get on that's what happens when we get on the line.
Yeah, I mean, that could be a totally different, interview, man, where we just talk about that. But like I said at the beginning, Sam has a lot of interesting, information to share. So one of the other things, moving on from dysfunction in the eyes, the auditory system in the upper neck, one of the other concepts that we wanted to talk about, and I've never heard this from anybody other than Sam, so I'm going to let him explain most of this, but what I want you to talk about, Sam, is the neurological link or association of neurons and muscle links and pain states and posture. We talked about this a couple weeks ago, so you want to kind of tell people about that and like basically just kind of go through that in your own language.
Well, I think that one thing that you're going to see a lot more of in the field, it's already starting to get out there a lot. It's just becoming a little bit more of a trend is pain science education. And what pain science education is, and this isn't extremely brand new cutting edge. It's been around for the last 15, 20 years now. Is that the education on pain? One of the things that we're never taught as a society is how to interpret feelings like pain that we experience. What does it mean? And most of us know that there are different types of pain, kind of like intuitively. There are some types of aches and pains that we know are an emergency. There are some types of aches and pains that we tend to ignore. But now we're really starting to see that the line and the separation is between acute and chronic type of pain syndromes. What does pain mean when pain is ongoing for long periods of time, even past the point where tissues are already healed? We know that how long it takes for a muscle to heal from a strain. We know how long it takes for a bone to heal after it's been fractured or broken. But why is it that pain will persist after the tissue is already healed? What is it? And so now we're starting to realize that by educating people on what pain is, and oftentimes, let's put it simply, a lot of times it's the nerve has learned a pattern of behavior to be threatened or be on guard after an injury has long since healed. So the interpretation or the meaning that we associate to the pain signals that we feel oftentimes can exacerbate the pain that we experience. So when we teach people about what pain is and about nerve sensitivity and so forth, that is therapeutic in and of itself and can oftentimes be very, very helpful in the process of reducing muscle tone, reducing excess guarding and being threatened by movement and feeling like you're going to get re-injured and so forth. And it has profound effects. And in some studies has shown that the educational component itself on pain science was enough to get people almost completely out of pain. So now we're looking at how do we integrate pain science and teaching people about pain with things like structural rehabilitation work posture, health disciplines, all of these other factors that really will work together to desensitize people to those pain signals, to reduce the guarding and the threat, and get them to basically regain function and get their life back.
Yeah. So there's a lot of technical info in that little blip. A lot of this comes down to like Pavlov, yes? Or a lot of it can be, you can derive a lot of this from that. So like, am I right on that kind of train of thought?
Yeah, it's learning. And, nerves habituate and learn. And I think one of the things that has become clear is that, pain is like a behavior. And a behavior over the short run can be interrupted and stopped, but the more patterned it becomes, the longer it's been around, the more it's going to essentially drop into the subconscious and become automated.
Doesn't that pain state, too, also become linked with postures? Like if you experience pain a lot in like a kyphotic posture with your upper back rounded and your arms turned in, wouldn't that posture become neurologically associated as like a stimulus with that pain state?
Yeah, it can be. And a lot of people will talk about this a lot. You even hear it in the Tony Robbins event where he talks about that your physiology and the way that your body is and the way you hold your body is associated with feeling states.
Yeah.
And we know that. Most depressed people don't stand upright and smile, and it's just not the way that our physiology, it's incongruent.
Yeah.
So oftentimes when we're stressed, when we're in pain and so forth, we tend to assume these guarded based postures. So already they're neurologically linked to the way that we emote and the way that we feel.
Let's explain what that means, neurologically linked, right? So that because people watching this might not have like any technical knowledge on this kind of thing. So like Pavlov was a psychologist. He did a lot of research back in like the early 1900s where he basically was doing work with dogs, and he had like a bell, right? And he would I forgot what he did. He basically would feed the dogs every time he rang the bell. And then eventually that bell became a stimulus that provoked this appetite in the dogs. Even if they weren't presented with food, he would just ring the bell and they would salivate. So that ringing of the bell became a stimulus that provoked this state of hunger in the dogs, because when you pair a stimulus with a certain state over and over again, they become inseparable. And then whenever the stimulus is present, it automatically invokes that state. So basically what Sam is saying, or one of the things he's saying, you can extrapolate from this, is if you experience pain all the time in a certain posture, that certain posture can be like the stimulus. It can be like the ringing of that bell, right? And that can basically become linked with that pain state, so that even if you don't have some sort of soft tissue injury, just by resuming that posture, it's like ringing that bell. It's like teaching your body that it's supposed to be in pain in that position, and you're going to experience pain in that position. Am I right in kind of extrapolating what you said there with that, Sam?
Yeah, it's a good overall, description. I mean, there's a lot of individual examples that could be a good demonstration of that. So, for example, somebody injures their spine when they go into an extension movement, right? And pain signals pop up telling them, hey, stop doing this. You're stressing the tissue. But once the pain starts to resolve, anytime the person starts to go back into extension, they start to guard, right? So the pain signal is there even when the tissue is healed. So now they've become programmed to be afraid of the extension. And for whatever reason, it could be, a doctor told them that they damaged a disc or whatever. So now the person they're programmed to not move into that position. And in fact, to start guarding and almost creating pain signals because they believe that something is going to occur in that position. They've been trained. And a lot of times that's breaking that pattern where when you have to teach them that there is nothing that's going to happen as a result of doing that movement, providing a safe environment and encouragement for them to do that motion, and then it starts to break the cycle. So I mean, it is fairly profound to see this sort of thing happen. I've seen many people where the doctor says, your MRI, your X-ray, there's nothing wrong with you. But yet the person is so guarded with movement because they've been conditioned, and you have to get them out of that conditioning. You have to teach them how to move again and not have those kinds of feeling states of fear and guarding and so forth that are associated with those movements.
Yeah, that's like when you originally told me that a couple months ago or whenever that was that we talked and you shared that concept with me. That like blew my mind, man. You know, because most people I think that they're whenever they have pain that there's some sort of mechanical dysfunction, like a torn piece of soft tissue, a herniated disc that's impinging the nervous system or something like that. But that's not always the case. Sometimes it's just completely, neurological, and sometimes there's physically nothing even wrong with the neurons or the tissues, like what you're saying. It's it's like a psychological thing, you know. And pain is just weird too, because like, what is pain? It's like neurological signals firing up your nervous system, right, going into your brain, and that's like a weird, ethereal kind of like intangible thing. But like, what this explains why changing posture too can oftentimes remediate pain for people, right? Like you could be improving the way the joint functions and articulates, moves around, which is mechanically more efficient. And like obviously mechanical dysfunction plays a role, right? If you have like frontal acetabular impingement syndrome and the head of your femur is like running into the acetabulum and it's pinching all the tissues in there, that's like a mechanical dysfunction. That might be causing the pain in there. But that might not be the only thing that's going on in there too. So, this when you shared that with me, man, it really like blew my mind and it made me think about, the way I approach my clients and even myself like way differently.
Yeah.
So yeah, go ahead.
Pain is complicated, and you have so many people, as with everything else that we tend to see, is that people go really hard line to one end or the other. You'll see that some people, when they start to read and understand pain science, now they dismiss everything mechanical. And they say, look, none of this posture stuff matters. None of this movement stuff matters. The only thing that matters is teaching the client. I mean, frankly, you could just sit there and have pain education talks with the client, and their problems will all go away. And that's just nonsense. It's not true. It's a combination of approaches, and because of the level of complexity, people can't seem to kind of grasp how all of that stuff works together, and they get frustrated with it. So, absolutely. I mean, if information is going to your brain that there's compression of key structures going on inside of your hip, your brain may interpret that as a threat, and it's going to send pain signals down there to tell you to stop doing it. Yeah. So the state that you have associated to that pain through the physical alignment of your body can be altered by moving it away from that state. So a lot of people, let's say, for example, when they get chronically stressed, they start to move into an extended base posture, a lot of anterior pelvic tilt, etc. But they also may shift their body weight to the right. So they start to move to the right and extend themselves. This is their stress state. That's their stress physiology. They have a state of consciousness that's associated with that. Now, what's going to happen is that if I take that person who also has pain in that state because they're stuck in that psycho-physical state all the time, and I shift them to the opposite position. I get their weight bearing on the left and I flex them. I do the complete mirror opposite, antagonistic and reverse position. Their state of consciousness is going to shift. And if you're familiar at all with cognitive sciences like hypnosis, the first thing that you do with people when you identify the problem state for them, the second thing that you do is you disassociate them from the problem state. And you can do that any number of ways, but when you create this altered state, the first thing that occurs is a minor state of confusion in the nervous system. So what you're essentially doing there is that you have a fresh, clean slate. And from that slate, you can start to develop what you want. And if that person happens to not experience pain in that position, I want to start conditioning them to be in that position so they can learn how to move fluidly between those two positions and states.
Yeah. Wow. It's very interesting. So it's like taking one bell that you used to ring all the time that every time you ring that bell caused pain, and it's like you're getting a totally different bell at a different, sound frequency, and you're ringing that bell.
Yes.
Yeah. So it's just basically changing the stimulus, right? Because for you, in that example that you use, leaning to the right and extending the spine, that's like the stimulus. That's the position of the body that has become linked with that pain state. So you're just doing the exact opposite, flexing the spine and leaning them to the left to create like a new pattern that's not associated with that pain state, right?
Yeah.
Yeah.
And see if they have pain over there. And if they don't have pain, remember, if somebody is shifting over to the right and they're in that state because they're escaping dysfunction on the other side, they could have pain over there too. So we have to figure that out. And really what it comes down to is that the body, we need to free up resources. The body needs to be able to move in all different sorts of patterns and behaviors and so forth, and not be stuck in them. Because when you're stuck and you run out of options, that's where you're in perpetual pain, because the body has nowhere to go.
Yeah.
And, we need to free that up.
Yeah. And I think, one thing that I want to make clear too is this is probably one of the main reasons. I mean, there's a mechanical reason why corrective exercise, postural restoration, even something basic like just foam rolling, there's a mechanical reason why you're going to benefit from those. But this is another one of those reasons why you might benefit from those things, right? When you change your posture, you're sending your body a new signal. Even when you foam roll a muscle, you're shutting down that neurological drive going into that muscle. The muscle is able to relax a little bit. The length of the muscle might change a little bit, and that's like a new stimulus, again, that's not necessarily associated with that other pain state. I think it's just really important that people understand this on a conceptual level, because it opens up all sorts of, it just opens up your mind to thinking about things differently, and you can, your level of self-care can just advance a lot further if you understand the kind of stuff that we're talking about here today, I think, which is really cool.
And what you're doing is a lot more. I mean, it's not simple postural correction. It's not simple mechanical fixes. You're putting stimulus into your system for your system to absorb and to learn how to react to and change and adapt to. And it's powerful, powerful stuff. So when I tell somebody, when we tell them roll back your pelvis because you have too much anterior pelvic tilt, is it purely just because of their back and their hips and their joints? No, you're doing a whole lot more for them than just that, if that's a pattern that they're stuck in. So I guess it's a higher level view of what you're doing. And sometimes it bothers me for people that think just purely that when you're doing corrective exercises, stretches and so forth, that you're just doing this purely mechanical thing. And you're not, because you are a nervous system, and there's a whole lot of other things that are associated to that than just your pelvis, your hips, etc. It's not that simple.
There you go, man. Just nailed it on the head with that. So when Sam told me that, it blew my mind. But we're getting close to the end of this interview. I know that you study pain science a lot. I don't know if you have any insight here outside of what you've already shared, which has been a lot. But is there any knowledge that you might have acquired over the years with regard to pain science that you think people need to know about that's not commonly known, other than the kind of stuff that we went over here today? Anything else?
Yeah, that pain is not permanent. And then I think that's one belief that people need to break, that oftentimes, and again, I want to separate acute versus chronic. Acute is that short term, you pull a muscle, you get a cut or a scrape, or you get something that obviously you need to heal from. But if you've been in pain for, long periods of time, months, if not years, your situation is not hopeless. It's the understanding of pain and developing systems and strategies to reduce nerve sensitivity that's ultimately going to lead to your success. You're not going to permanently be in pain, and you can gain back control over your body through using this kind of science and using an integrated approach. I mean, and that's what I've spent probably 16 years doing with people and evolving, is teaching them all of the aspects of health, looking at posture, looking at nutrition, looking at their stress levels and their internal states, and teaching them how to reduce that threat and that guarding so that they can move throughout their lives and go live the life that they want. Because, your life is not just about your pain. It's about, moving past that to go doing other things. I mean, and that's what I hope for people, that pain science education will give them, is a brand new understanding and a new lens and a way of looking at these things.
Yeah. I like what you said about pain is not a permanent thing. It's temporary. And understanding it more, like everything, gives you more ability to deal with it and remediate it, get rid of it.
Yeah.
Well, sweet, man. What an awesome interview. This was amazing. I always learn something, like I said, whenever I talk to you, including today. Had no idea that, switching up something visually like this could potentially help with, some of the issues that we talked about here today. So, I always learn something when I talk to you, man. Appreciate you for coming on here, brother. And, we'll definitely have to do this again, Sam.
Thank you. I loved it. Much appreciated. Always a good time talking with you.
Always, man. All right. Well, talk soon, man.
All right, man. Later.
There you have it, guys. I hope that you enjoyed this video between Sam and I had a lot of fun recording that with him. So if you did, don't forget to subscribe to my YouTube channel. Click this. Also, if you want to learn more about posture and stay up to date with regards to posture and what I'm doing in that space, click this right there, and that will take you to a page on my website where you can download my ebook, Posture: The Ultimate Life Hack. Watch this video if you like this video, and I'll see you next time.